Hello guys, my name is Tatiana Vanhanova and today we will talk about the muscular system in children. As usually, we will start with anatomical and physiological features of muscles in children. We will remember the function of muscle and muscle tone in people, in children in particular. Then we will talk some specific features useful when you evaluate the muscle tone and muscle state in children, especially in young children, newborn children, and then we will continue to talk about specific signs of pathology typical of muscular system disorders like hypertonus, for example, of muscles. And then at the end, we will see the additive methods of investigation used today for diagnostic of muscular disorders in people. So, why we need muscles in general, yes? First, we think about it is about movements, yes? When I want to write something down, when I want to touch something, when I want to drink tea, I need my muscles because they are helping me to move my extremities, all my body. But it's not just for this we need muscles. Look how many muscles, how many functions our muscles have. First, it is our posture and tone maintenance. So, to maintain my sitting position now, I need my muscles working. Movement organization, everybody understands it. It's clear. Joint stabilization, in order to maintain our joints in normal position, we need muscles, not just to move, but to maintain. Heat generation, you all remember that heat is produced by muscular work. When we need to increase the temperature inside our body, we need our muscles to work to perform this small contraction of muscles when energy is produced and temperature is increased. That's why we are not dying just right when we have the decrease of environmental temperature. Muscles can protect our inner organs, for example, organs of our abdominal cavity. They are protected with abdominal wall, muscles of abdominal wall, and they are well protected. Our stomach, intestine, they are well protected with our muscles. Cardiac compression, blood pressure control. Cardiac compression, we remember that our heart is muscle. And without these compressions, we have no blood circulation, we have no life. Blood pressure control is performed by heart and smooth muscles of the vessels. So if vessels are well working, they are controlling the blood supply of all our organs and systems of our body. Muscles can regulate the passage of fluids and substances in our body. For example, what we are talking about sphincters, yes? And sphincters, they are the muscles responsible for the controlling of the temporary presence of, for example, our food mass, partially or completely digested through our digestive tract. So muscles of pyloric sphincter closed, our food mass stays in our stomach to be digested, for protein to be digested. Then it goes lower, it goes to duodenum. Why? Because the sphincter is open. So sphincter is controlling the movement of our food mass, and it concerns not just digestive system, but urinary tract, for example. Yes, for urinary tract, urine goes from the ureters to the muscular organ, urinary bladder, and there are a lot of sphincters there to leave the urine in our urinary bladder until the time for us to urinate. Breathing Without muscles, there is no breathing, because in order to breathe in, our diaphragm goes down, our intercostal space, intercostal muscles, they're contracting to expand our thoracic cavity. And like this, when we expand, there is negative pressure in pleural cavity. And like this, we have a gradient of pressure inside the cavity, negative, and environmental pressure. And our air goes where pressure is low, so where is negative. Like this, we breathe in. Without the movements of muscles, there is no process of inhalation, there is no breathing. No speech, sure, we need to talk, we need to pronounce the words, we need our muscles. As our tongue, we as well need to chew the food well. So muscles are performing a lot of different functions in our body. They're extremely important for us, And I remind you that there are 3 types of muscular tissue, depending on the presence of this muscular tissue. So we have skeletal muscles, we have cardiac muscles, heart, and we have smooth muscles of the vessels. So how they are different muscles in children and adults? First of all, the first thing we think about when we talk about differences, about the number of muscles. So let's remember that number of muscles in child body is the same as in adult body, but muscular mass, weight of muscles is importantly lower in young children. In premature children, these muscles are, muscular mass is extremely small. With age, it increases, and in adults, it depends on the physical loading of these muscles. But when we compare with a child, it is importantly higher. Length and circumference grows. Like this, you will see that muscular mass grows. And when we talk about the structure of muscles in children, especially in young children, in infants, we should tell that muscular fibers are thinner, sarcoplasma in higher quantity, as well as interstitial tissue. So muscles are more elastic, but poor in myofibrils. And as well as all other tissues, muscular tissue is rich in water. As well as I have already told you that all organs and systems of a child body are rich in water, but poor in minerals and myoglobin. But still, myoglobin is present. That's why once destroyed, it may be additional source of bilirubin formed, for example. Now it is a time to talk about the muscle tone. Why we need it? When we think about muscles, we think about movements, we think about our appearance, it's great. But why we need muscle tone, and what is it, muscle tone? Muscle tone, it is super small contraction of muscles, which is involuntary. So it means that you are not controlling it, but it is still present. Why we need it? Why not to relax for our muscles once we are relaxed? Because it helps to keep skeletal muscles firm and ready to move. Yes, ready for movement. It helps to maintain the upright head position. You remember that head position is very important for blood supply of our brain. That's why it's extremely important to maintain the upright head position. Muscle tone helps to maintain the blood pressure. Now we are talking about the muscle tone in general of muscles, skeletal muscles, and muscle tone of vessels. Muscle tone of vessels depends on the prevalence of sympathetic or parasympathetic, so vegetative nervous system, which is different depending on the moment of your life. You're eating, relaxing, or you're running somewhere. You can have prevalence of sympathetic or parasympathetic muscles like this, you will have different state of your vessels. Some are narrow, some are dilated. So where muscles are controlling the spasm of vessels, their blood supply is decreased slightly. Where dilated, it may be increased. It depends. Yes, it depends on sympathetic or parasympathetic prevalence. As well, muscle tone helps to maintain the steady pressure of digestive organ content. I have already told you about the importance of sphincters, but as well, the muscle tone of the wall of the stomach and intestines is important for the normal process of digestion of food inside these organs. How to evaluate the muscle tone? Let's go here and see that normally physical evaluation, a physical examination of muscle tone includes the visual examination. You evaluate the symmetry of posture, yes, symmetry of muscles, especially when you're talking about symmetrical muscles of extremities, yes, intercostal spaces muscles. You can see, while visual examination, inflammatory signs. When muscle is inflamed, you can see sometimes the swelling of muscle after the trauma, for example. As well, when you palpate, you feel the pain, if it is painful, yes, or you can evaluate the muscle tone. If muscle tone is increased once palpated, you can feel this, or vice versa. When muscle is weak, you can feel this while palpation. Muscular force may be evaluated, and position as well. You should obligatory check how child is moving, how he is walking, how he is able to do some exact movements. For example, please give me this toy. And when child is changing his position, for example, once in bed, you ask a child to sit down, or once child sits down, you ask a child to stand up. And in this case, you can evaluate how successfully and quickly child changed the position. It looks like so easy to change the position, but for children with muscular hypotonus, lower tonus of muscles, and muscular weakness, a pathological shoe, child may have troubles in changing the sit-down position to the stand-up position. Look how on a picture, Gover's sign, look how it looks like. Difficult for a child to stand up. You ask a child to stand up, and child first try to find the support with his one leg and two hands, and with difficulties lift up his legs, his lower part of truncus. Then look, he put his other hand on the knee to have additional support to lift up his back, and he is lifting up, and then he stands up. It's bad, yes. All this specific chain of movements is called Gover's maneuver. It is typical for muscular weakness, for muscular dystrophies associated with muscle hypotonus and muscular weakness. So other disorders like specific waddling style of walking may be found in case of muscular disorders. As well, when muscles cannot perform their functions, for example, skeletal muscles, you can see the vertebral column moved, deviated to the back, so scoliosis appears in this case. Or lordosis appears. It's as well the deviation of the vertebral column. If there is a pathology of sphincters, you will see the problems in maintaining the urine, the defecation, disorders, which is called dysphagia. In this case, you suspect the anomalies of sphincter. But when we are talking about young children, about newborn children, sometimes it is important to find out the neuromuscular maturity of newborn child. You remember that there is a specific feature of newborn child. This feature is about the specificity of muscle tone of newborn child. In newborn children, muscle tone of flexor is increased because it is controlled with stria pallidor system, which is the best part of brain developed till the moment of birth. And upper systems like thalamus pallidor and brain are underdeveloped, extremely underdeveloped, and not controlling the pallidor system. So pallidor system gives the signal to those flexors to be flexed, to have a higher tonus, and it is flexed. That's why even relaxing newborn child, even sleepy newborn child, will have his extremities well flexed, like on the picture, and it will be symmetrical look. But it is typical only for children who are mature, whose muscles are well developed already, and when there is a good control of nervous system performed by nervous system in normal children. Because if a child is born mature, but there is a problems of nervous system, like for example in case of lack of oxygen caused by birth process, which is called hypoxia of brain. In case of hypoxia of brain, asphyxia, birth asphyxia, when pathology, affection of brain is too important, there is no more great signal going to the muscles, and muscles are in hypoxia as well. That's why child has no flexed but extended extremities. It is evaluated with Apgar score, as you remember. In Apgar score, which helps you to evaluate the primary state of newborn just after his birth, you can evaluate the muscle tone as 0, absolutely extended extremities, 2, well flexed, symmetrically flexed with movements, and something in the middle, 1. So you remember good when child has well flexed extremities. But if child is premature, if his muscles are immature, he has some specific signs to be evaluated. This specific sign belongs to Ballard score. Look, it is a Ballard score. So how we evaluate a child neuromuscular maturity according to Ballard score? We evaluate some specific signs like posture, square window, arm recoil, popliteal angle, scarf sign, heel to ear. These signs are evaluated according to the score, and on the picture you can understand what is the way we evaluate. So we look on a posture first. We remember maximal score is good, the best for newborn mature baby. Minimal score is the worst, typical for super immature baby, very preterm, whose gestational age makes 22, 23, 24 weeks of gestation. You remember, it's just middle of the pregnancy, so it's super immature child. It's very, very immature child. So for good mature children, term babies, all 4 are typical. 4, 4, 4, 4, 4. So how it looks like? Look, child has, like on the picture, well flexed lower and upper extremities. Square window makes 0. I cannot perform it, but child can. So angle between your forearm and your hand is 0. Mine cannot be 0 because I have adult proportions. Arm recoil, look how a child has the angle between the elbow angle, yes, look. When you try to extend, once extended, it comes back to this angle. So it is this angle makes less than 90 when child is mature. Popliteal angle in analogy, yes, this elbow, it is like knee popliteal angle. So look, this angle makes like 90 or even less than 90 if child is mature. Scarf sign, when you move his hand to reach maximally the back, that's why it looks like scarf. So when you move the infant hand like this, look how it's difficult to do when child has good tonus. He has good tonus, so it's too difficult to move like scarf. No, and heel to ear, you understand what you want. You want to reach the ear with heel. So it's not possible for a well-mature child with good tonus, because this tonus is too big and child cannot reach ear with his heel. So when child is super immature, 22, 23 weeks of gestation, very preterm, he will have no muscle tone. Look, there is no flexion at all. His popliteal angle is like in mine, yes. His arm recoil. You extend the arm and child leave this arm in an extended position, yeah. As well as popliteal angle is very great, very big. Why? Because there is no tonus of legs. Scarf sign. There is no tonus of muscles. That's why this movement of scarf is very easily done. As well as you can easily reach the ear with heel because there is no muscles of to control the movements. So like this, Ballard score is evaluated. It is only first part of Ballard score. It exists the second part of Ballard score. Second part of Ballard score includes the morphological signs of a maturity of preterm baby, like shape of ear, like presence of testicles in scrotum, like position of umbilical cord, like presence of primary hair. It is different part of Ballard score, which evaluates the general appearance of newborn baby. When you have an amount between morphological signs of immaturity and neuromuscular together, when you have an amount, you have the final Ballard score for particular baby, and you can realize if this baby is mature enough for his gestational age. So now it's time to talk about the pathologies. So we start to talk about muscular hypotrophy. Hypotrophy, it is lower muscular mass, like on the picture. So usually muscles are not well developing in children whose weight and height are not well increasing, like in state which is called failure to thrive. So when child has a physical development delay, when he is not growing up well, he may have muscular mass decreased. Look, on the picture you can see this child who has 6 years old. Look how he is skinny. He has no fat, but as well you can see his bones. That's why his knees looks like so big. Why? Because there is no muscles, there is no fat to cover, and proportionally child looks like not just skinny but without normal muscles. That's why he has such a bulging abdomen, because muscles of abdominal wall are underdeveloped as well, are in hypotrophy. And this state may be associated, for example, with celiac disease, disorder of the digestive system disorder, yeah, and Emily-Dreyfus muscular dystrophy, like on a picture, when child has not just hypotrophy but hypotonus as well of muscles, and hypotonus of muscles and hypertrophy of muscles is so big that for this child it is difficult to maintain his head in a right position. That's why it looks like too difficult to maintain, so child move his head down. He's not resisting the gravity, and he has the deviation of vertebral column formed. Why? Because he has not well developed skeletal muscles responsible for the posture. Muscle hypotonia. Hypotonia, it is not a question of muscular mass, but it's a question of the muscular tonus. This small contraction of muscles we have already told earlier. So when muscles are present but they're not able to perform the normal, this involuntary muscular small contraction, we call this hypotonia. And when all muscles of body, skeletal muscles of body, are in hypotonus, we call it the syndrome of floppy infant. So child looks floppy and feels floppy, like on a picture. And when you change the position, when the child, you lift the baby up, look, his hands and his arms and legs, they are hanging down, they are not flexed at all, which is pathological, and it is symmetrical, yes. And look how easily hand is moving, head. Why? Because neck muscles are as well floppy. Like on the picture, once you lift a child up, his legs stay extended and not flexed at all. Look, the increased joint mobility may be checked like this, and this increased joint mobility as well may be associated with hypotonus. Why it may happen? Once you see a child whose skeletal muscles are in hypotonus, first you think about central nervous system pathologies. If it is a young child, you think about birth asphyxia, hypoxia of the brain caused by problems in pregnancy or delivery. Meningitis as an inflammation of meningia, kernicterus. It is a state associated with hyperbilirubinemia. It means high level of bilirubin, indirect bilirubin, and conjugated bilirubin going to the brain and causing toxic effect on brain, affecting the brain tissue because of the presence of this indirect bilirubin there. Intracranial hemorrhage or cerebral palsy as well can cause such a hypotonia. Microsomal abnormalities. The most probable chromosomal abnormalities is the trisomia, like Down syndrome, for example. Second important group of disorders resulting in muscle hypotonia is myoneural junction disorder. They happen in general rarely, but there are a lot of hereditary myoneural junction disorders which may start in child age, yes, in childhood. But depending on the disorder, it may start in a different period of childhood. For example, myasthenia gravis usually has its onset at the age of puberty, so in teenagers, and mostly in girls. And other, for example, congenital muscular dystrophy, especially Duchenne muscular dystrophy, starts at the toddler's age. Spinal cord injuries as well as peripheral nerve disorders may typically cause hypotonus of muscles, as well as general infection, generalized, especially sepsis, especially in newborn. It's very typical to have muscle hypotonus in newborns who have sepsis. That's why muscle hypotonus may be one of non-specific signs of early signs of sepsis in newborn babies. Hypertonus means vice versa, two important tonus of muscles in children. We can call it as well spasticity, spasms, yes, spasticity. So what are the probable causes? Cerebral palsy as well. So now you know that cerebral palsy may cause different changes of muscle tone, hypotonia or hypertonus spasms. Intracranial hematomas, meningitis, especially meningoencephalitis, multiple sclerosis, which starts rarely in young age, spinal cord injuries, especially burst traumas, infectious diseases like tetanus may cause hypertonia. Tetanus, it's one of the most dangerous infections, but we can prevent it with vaccination. That's why we remember that now the incidence of tetanus is low thanks to vaccination. How it looks like muscle hypertonus. When there is a hypertonus of skeletal muscles of back and lower extremities, look. If it is extensors, look how is the position of a child. It is typical for tetanus. When this spasticity touch the plant, there is a problems in plantar flexors spasticity, and there is a specific position of child plant look. Sometimes it stays with time, especially in case of cerebral palsy, and like on the picture, child has problems in walking because imagine how it's difficult to stand up to support on this plant, on this spastic plant. That's why to find the balance, it becomes very difficult. As well as if you have spasticity of the arm, of the hand, yes, if flexors are too in spasm, you have difficulties in writing, yes, in moving, and there is a specific position of a child in this case. One of the most important signs of the higher spasticity of children, it is a sign like on the picture. You see the sign of the knife. Look. And it is the sign of the clasp knife when you flex and extend the child with spasticity. You can see the sudden relax of joint when you try to flex it or extend it. So first look on the picture, extension force, and there is a resistant collapse like a knife up. This sign is typical for spasticity in children and adults. Sometimes muscle tone becomes asymmetrical, like on a picture. So normally when child, if it is a newborn child, perform his normal posture, when his head is in medial position, he should have symmetrically flexed arms and legs. But you remember, there is an asymmetrical positonic reflex, like on a picture. You can see when you move a child head to the side. On this side, leg and arm are extended, and in a different side, they stay flexed. Up, up. But when you come back a child head to the medial position, you should have the symmetry of tonus. It is a reflex. It disappears till the age 2-3 months old. But when you don't move like in this picture. Technically, child head is in a normal position, but he has one arm normal tonus and left arm completely extended. So they are not symmetrical. You realize that this is dystonia. Why? Because left arm is extended and there is a hypotonus of flexors in this case on the left side. What is it? It is burst trauma of plexus brachialis, which is called Erb's palsy. Erb's palsy. Look in the picture as well. Another problem may be associated with the different tonus of the muscle, symmetrical muscle, sternocleidomastoideus. In this case, one muscle may have higher tonus spasm and the other muscle may have a normal tonus. When it is a problem of tonus, it's not as big deal as if it is a problem of shortness of one of the muscles. So in case of torticollis present on the picture, you see that one sternocleidomastoideus may be shorter and have higher tonus of being spasm, and another sternocleidomastoideus is normal. Like it causes a specific position of child head. Look, like on the picture. In this case, mother will tell you, you see, doctor, my child always maintains such a position. So my child seems like looking on the same side always. When I try to change the position of head, he is coming back. So you palpate the sternocleidomastoideus. You find out in palpation how muscles are resisting, and if there is the same tonus, if there is a same if they are long enough, both, yes, and if the child has or not such a specific position of the head. If you suspect torticollis, you ask the orthopedic and traumatology consultation in order to prove your guess about torticollis. Sometimes it needs even surgical treatment, such a disorder. So when you suspect the diagnostic, some diagnosis, you need to know what additional additive methods of investigation may be used to diagnose muscular disorders. You can use lab tests like enzymes test. When muscles are affected, usually we can see evaluation of some enzymes. For example, skeletal muscles affected, we can see the increase of creatine kinase, like in case of myodystrophy, of Duchenne myodystrophy, or in case of dermatomyositis disorder, systemic autoimmune disorder, typical for boys, especially in puberty period. As well as alanine and aspartate aminotransferases, which may be increased in case of pathology of muscles, especially heart muscles. Genetical testing is performed when you suspect some hereditary disorder like myodystrophies. And we have some instrumental diagnostics way to diagnose the muscular disease. For example, electromyography. It is a way to find out, to register the biopotential, electric potential of the muscle while contraction, and how it is spread through all muscle, how it's coordinated, as well as how it is spread on all muscle long. It is very useful when you diagnose the peripheral palsy, when you diagnose the inflammation of nerve, some peripheral nerve inflammation, or when you diagnose some myodystrophy. And some other instrumental additive methods of investigation you can use. For example, MRI you widely used to find out if we have or not central nervous system disorder. We suspect, for example, intracranial hemorrhage may be diagnosed with such a way of investigation, way of diagnostic, or inflammation may be diagnosed as well. Muscle biopsy is widely used to diagnose hereditary myodystrophy and tumors, for example. And other tests which are used to find the function of heart or structure of heart, like in case of electrocardiography or echocardiography. And lung monitoring tests in order to diagnose the problems of muscles, breathing muscles, for example, diaphragm. So these methods, you can use them and formulate your diagnostic right. And we finish our lecture with a case. Look on the picture, you can see a child. It's a boy. His name is Eric. He has 4 years old and he appears floppy and has a very weak muscles and looks smaller than he is. Mother tells that he started to walk at the age 18 months old, which is technically maybe considered as slight delay. We expect a child to walk at the age 1 year old, 12 months old, yes. Mother tells that starting from the age 3 years old, she noticed progressive weakness of muscles in legs and arms of the child. And now he has 4 years old, but he has a hard time standing up, walking and climbing stairs. So, and you remember that maybe you may suspect the Gover's maneuver. You will check it. On the picture, you see the child has the deviation of vertebral column. And you think about Duchenne muscular dystrophy. What you need to remember about this dystrophy, it's the most widespread muscular dystrophy in childhood. No, hereditary muscular dystrophy in childhood. There are a lot of them, and generally speaking, it's a rare disease, but still it may happen. It happens mostly in boys. Why? Because it is X-linked recessive inheritance type disease. It's associated with progressive muscular weakness, difficulties in moving, Gover's maneuver, and scoliosis. What to prescribe to prove your guess about the Duchenne muscular dystrophy? Blood biochemical test, so it's lab additive method to find out increase of creatine kinase, because skeletal muscles are affected. You will perform muscular biopsy to prove your guess with low level of the specific protein, dystrophin, and then you finish your evaluation with finding out with genetical testing to find the mutation in X-linked gene encoding this protein dystrophin. Once everything is done, you diagnose Duchenne muscular dystrophy. Mostly it's neurologists responsible for treatment of such babies. Thank you for your attention. Have a good day. Bye.